Hey folks, it's Dr. Gerstmar from Aspire Natural Health. I wanted to talk today about the inner critic and how we talk to ourselves. Now, you may at first think, what's this got to do with natural health? And the answer is everything. So with natural, alternative, integrated, naturopathic health, functional medicine, whatever label you would like to call it, we focus a lot on the foundations, which is really lifestyle, what we're putting in our mouths, sleep, stress, exercise, those kind of things are habits. Now, as all of you know, changing habits is difficult. It's challenging. A lot of times we resolve that we're going to eat better, we're going to get more sleep, we're going to do these things. And often with the best of intentions and often the best of effort, we still have slip-ups, we fail, we don't make the grade. And oftentimes then that leads us to a vicious cycle of just beating ourselves up tremendously. So I had a discussion with a patient not too long ago talking about what this person was doing and a lot of the self-talk that was going on for them because they were feeling very discouraged, right? They had done pretty well, they'd had some slips, they'd seen some backsliding in their health, and they were really tearing into themselves internally, right? And most of us, I think all of us, have a vicious internal critic. We say to ourselves truly terrible things. You're a failure, you're horrible. We also say things like nobody loves you, you can never get better, you're a terrible person, you deserve a lot of this bad stuff. We say truly horrible things to ourselves. So in our discussion, the idea came up of saying, listen, this particular person had children. If your children came to you and they said, Mom or Dad, I messed up, I made this mistake, I failed in doing this thing, would you turn around to them and would you say, you're horrible, you're lousy, you're no good at this, you will never be good at this, and I hate you? Would you say any of those kind of things to that child? And the person was like, well, of course, I would never say those kind of things, right? And if you have children listening along to this, you would never say those things to your children either. I never would. But would you say those kind of things to yourself? And the answer to a lot of us is yes, I would and do say those kind of things to myself. And of course, why would we treat ourselves so much worse than we would treat someone else that we loved and cared about? Now, hopefully, and I know this isn't true for a lot of people, you love and you care about yourself. Because the bottom line is, look, when we think about these health habits, we often start with physical things, like what you're putting in your mouth, sleep, all these things that we've mentioned. But in order to do those things, we have to start from the top up. And often that's what we believe about ourselves. So for example, if you feel that you are truly a horrible person, that you will never have love, that you're doomed to failure, how good are you going to be? How successful, let me rephrase that word, how successful are you going to be at making diet and lifestyle changes in your life if you believe that you're a miserable person and you don't deserve love and health and happiness and success? The answer is you're not. Every day we see people, and this, again, there's no blame or shame here, but we see people sabotaging themselves. They're getting better. They're seeing improvement in their lives. And suddenly, they forget to take their supplements or their pills. Suddenly, they start eating off diet and eating things that are hurting them. They stop exercising. They stop doing the things that were helping them get to the place that they want to go. Now, there can be obvious reasons, life circumstances, but a lot of times what we see is that's not the problem. The problem is that they're running into a belief conflict. If you're doomed to be sick, but suddenly you're getting better, you're having a conflict between what you believe and what's actually happening. And the reality is what you believe is what's going to happen. If you believe you're sick, if you believe no one loves you, if you believe no one would be in a relationship with you, if you believe that you're doomed to failure, if you believe these things, you will make them happen. So we have seen, every doctor has seen someone who is on the road to success, getting the health, the vibrancy, the quality of life that they want, only to turn around and sabotage themselves and lose all of the benefits that they've gained and end up back in the bad place that they were at before they even started the work in the first place. So our self-talk comes out of our beliefs. but we can start to change our beliefs by changing our self-talk. And so, for this person, and I urge you, I know I'm trying to incorporate this more into my life, is that if you have children, imagine your children coming to you with the same issues that you're dealing with. You know what? Child, I didn't succeed. I ate stuff that I wasn't supposed to eat. I didn't exercise. I didn't get enough sleep. You know, I sabotaged this, that, or the other thing, right? If our children came to us, we would say to them, it's okay. You made a mistake. We can have a little tough love. That wasn't the right thing to do. But we would counsel them in a kind and loving, if tough love, way. We wouldn't beat them down and yell at them and tell them how terrible that they are. So, if you have kids, I ask you to imagine that when you make mistakes, that you look at yourself. You separate a little and imagine yourself as a child, or imagine your child coming to you with these same issues that you're telling yourself, and reframe your reaction. What would you say? If you don't have kids, let's just imagine that, say, a 6, 7, 8-year-old, 5-year-old kid comes to you, someone you care about, in the family, or just a little kid comes to you asking for advice, saying that they made the same mistakes that you made. How would you respond to them? And I know everyone out there, you'd respond kindly and compassionately. Again, tough love is fine, but that kind of self-hatred or hating talk is not okay. So I ask everyone, begin to use this technique. Step outside yourself, and the next time you find yourself beating yourself up, I'm just a fat slob. I'm terrible. I'm lazy. I can never do it. I'm a failure. Imagine instead that it was one of your children coming to you, either talking in the same way or with the same problem. And take a moment to think about, how would you respond to your child, or to a mythical child that you're imagining has come to you for advice, or a best friend, or a spouse? You wouldn't hit them with a bunch of hatred. You might hit them with tough love, but you would give them some compassion. By changing the way that we talk, we can begin to change our beliefs. Does it magically fix everything? No, of course not. But if you've been going along well on an eating plan or an exercise plan or anything else and seeing the benefits, or trying to get started, and find that you slip up and make a mistake, don't succeed, or sabotage yourself, beating yourself up about it does not help in any way, shape, or form. It just makes you feel worse. Instead, you want to have some compassion for yourself, and you want to reshape your plan to make it more successful. All right? If we can help you shape or reshape that plan to give you success, please contact us. You can find us at www.aspire, that's ASPIRE, Aspire Natural Health, all one word, aspirenaturalhealth.com, or on Facebook at facebook.com/aspirenaturalhealth. We focus on helping people with digestive or gut problems, autoimmune diseases, and other hard-to-treat cases. We never give up on our patients, and we're always focusing on improving and getting better. If we can help you, please feel welcome to contact us. All right, folks, until next time, remember, beating yourself up doesn't help in any way, shape, or form. Have some compassion. Imagine your child was coming to you, a child, a best friend, a spouse, someone that you wouldn't vent hatred on, but you would give some compassion to, and maybe a little bit of tough love. All right, until next time, folks, take care.